Doctors of Reddit, what is your most awkward experience when dealing with members of the opposite sex? My attending tells me to go examine a patient, her chief complaint being that she was beaten up by her boyfriend. So I go in to see a tall, very attractive blonde sitting there crying. I calm her down and ask her the usual questions, and then I explain to her that I have to examine her from top to bottom to document the injuries. So far, the exam's going well until it came down to her stomach, then to her waist, then bam. Penis. Did not see it coming at all. I think my shocked expression for a split second caught her off guard, and she says, "Oh my god, I'm so sorry. I forgot to tell you, I'm transsexual." Yeah, I figured it out. We are taught to explain to patients exactly what we are doing, as we are doing it. Delicate wording becomes important during female pelvic exams. Instead of "okay, I'm going to place the speculum inside now, so you'll just feel some warm pressure," my buddy ended up saying, "Okay, I'm coming inside you now." The female patient responds, "No thanks, I already have 3 children." My granduncle is a urologist, and I got a boner from checking out one of his nurses when I was around 12. I then had to explain why I couldn't drop my trousers for an examination. He asked if I wanted to go to the bathroom to do something about that, so we can continue the examination. I had no idea what masturbation was, and he explained rather vaguely to me the gist of the operation. I didn't feel like trying it, so we just sort of waited until it went away. I don't know if it was awkward for him, but whenever I think about it, I cringe myself into the fetal position until I can block it again. My classmate and I were at a free clinic performing our first ever pelvic exams on standardized patients. Classmate is a big woman villager of a man and gets to go first. He proceeds to insert his fingers to palpate for the bimanual exam. Our poor standardized patient shrieks right away. She promptly states that for all women's sake, he's gonna need to use one finger for those procedures from now on. Not a doctor but a nurse. Trying to insert a catheter on a guy with a micropenis or inverted penis is pretty hard. One of my friends was getting a physical for a high school sport, I believe, and when it came time for them to check his gonads, the doctor says cough, but apparently my friend thought he said hop. So here my friend is standing there, the doctor has my friend's boys in hand and my friend hops. Said it was the most embarrassing moment of his life. I had to put a Farley into a male part. I'm young and female. He seemed nervous as I started. Right when I was about to insert the catheter with his penis in my left hand and the catheter in my right, he abruptly asked if it would help if he was aroused for the procedure and proceeded to gain some girth. Before I could answer, I said no. Doctor here recently walked in on a new mother in a sit bath with 2 breasts pumps gulping away at her all the while her husband grins from ear to ear as I worked her up for a pubic bone injury. The newborn could sense my embarrassment. When you get a vasectomy you get your duct taped to your stomach. A nurse came in to do the finishing after the procedure. She was middle age, and I'm guessing she probably got into nursing late because she was looking really nervous and uncomfortable, and anyone who's been in nursing more than a few years has had hands-on penis experience. She's kind of tentative and unsure about pulling the tape off, so I say, go ahead, it's been through a lot in its time. She got a big smile and ripped that head off of there, so she's totally cool in my book. My perspective may be off the scope of the thread, since I'm a veterinarian, not an MD. In my experience, people who do not want to neuter their male dogs are always males. Having a frank discussion about the benefits of neutering with someone who is emotionally attached to their dog's testicles is pretty awkward. My first pap smear was at Planned Parenthood when I was like 15. The male doctor got me positioned, then turned around to grab the speculum and said, "This is going to be cold, quack, quack," in a Daffy Duck voice, and using the speculum like a duck's bill. So, like the puppets dentists use for kids. Hey little lady, I'm Sam Da Speculum. Guess what I do? Being a resident in Saudi Arabia, There are huge stigma attached to male attendings examining female patients, especially those with gynecological issues. Also, being a foreigner residing here, some customs and practices catch me completely off guard at times. That being said, I was once in charge of my consultant's OPD during a obgyn rotation. Said consultant having left early thinking all major cases and appointments had been dealt with, and left me to clean up any stragglers in the last hour. In walks a 40-ish-year-old mother with her 18-year-old daughter, both completely covered from head to toe in burqas, who then proceeds to throw a tantrum about how the consultant wasn't there for her appointment, and how she left a male resident in charge of the OPD. A cursory examination of the daughter's file didn't reveal any history, which would help me decide if my superior should get involved. I then began to try to talk her down, asking her what her appointment was about and how I was in charge of the department. I didn't dare reveal I was just a lowly resident, and I would do everything in my power to help her out with any issues her daughter had been having. After a lengthy conversation, I find out that the daughter was there for virginity verification because she was to be engaged and subsequently married off that month, and appointments in my hospital's OPD are a biatch to get, and they needed to present that certificate along with some others regarding finances, genealogy and a few others to the prospective groom during the engagement ceremony. I went completely numb, detached, examined the poor girl silently. She was in the stirrups naked from the waist down, and burqa above that, not even an islet, and discovered, for the first time, a stack of thick, extremely official looking certificates in a desk drawer, to be given to women who pass the examination. I have since performed that examination close to 30 times, and have seen quite a few females who didn't have an intact hymen, and actually sobbed quietly in shame during the examination. I try to explain to the family that hymen rupture is in no way a sign of promiscuity or even sexual penetration. To those people I know wouldn't understand, I just certify their daughter's virginities and tell the girl to come up with an excuse later on to their families. Damn, someone tells on me, and I'm gonna be facing one hell of a malpractice suit. Not me, but a fellow classmate in medical school. We have mock exams, and various people will sign up to be patients. They get paid a decent amount. So he went in the mock exam room and started the basic history and physical on the fairly attractive female. Did this and that pretty standard stuff, grabbed and a tongue depressor, and had her open her mouth. Then, nothing. He did it again, and said with bewilderment, "That is weird, you do not have a gag reflex." She smiled and gave him a coy wink. He about lost it and couldn't finish. He walks out and finds the preceptor who monitors the exam about rolling on the floor laughing. As for me, I never really had an overly awkward experience other than maybe knowing someone, which can make certain exams a little awkward. I was the chaperoning nurse, young doc, first week in OB, and was seeing a early pregnancy patient in Tridge. Docs usually say, "I'm going to put my hand on your vagine now, or you will feel the speculum on your lips/labia." He was rattled and so nervous he conflagrated them as, "I'm going to put my lips on your vagine now." The patient and I roared with laughter for a second before we controlled ourselves. He shakily kept his dignity and kept right on going like nothing happened. He never referred to it again for the 4 years he was there. Not a doctor. Student rad tech. Had a patient for a regular chest X-ray series, but she was coughing up sputum. I asked her if she wanted a tissue to cough it up into, and she said she didn't spit. She was a swallower, and winked at me. I'm 19. She was 98. General surgeon, 31F. I work for a county hospital taking care of very salt of the earth patients. These are my people, as I was also born with a plastic spork in my mouth. Talking one morning to a young man who was about to get his inguinal hernia fixed, and his only question to me was, "When can I have X again?" The only person with him was his girlfriend, who was smoking hot, so I broke him the bad news. "You're gonna wake up feeling like a horse kicked you right square in the junk. So, go ahead and do what you want when you feel like you want to, but it's not gonna be today." We get him to put him under general anesthesia, and then a very young, Very pretty female nurse starts to prep him. To those unfamiliar, this involves vigorously scrubbing down the groin, including the penis and scrotum, with what amounts to a sponge on a hollow stick that dispenses a compound that decontaminates the skin somewhat. As soon as she starts scrubbing, the patient pops a raging boner. He's completely under and paralyzed, mind you, but the more she cleans, the bigger it gets, and yeah, this kid's a shower, I tell ya what. Poor thing, her face just gets redder and redder, and it gets bigger and bigger, and everyone's giving her hit the whole time. I finally stop her, because I'm afraid any second he's gonna break scrub and contaminate my field. We do our best to drape around old Ron Jeremy. It was hard. My poor, married with kids and straight as far as I know, male resident had to keep batting the damn thing out of our field during the whole case. Afterwards, I made sure to reiterate to the hot girlfriend that he probably wouldn't feel like having X in the near future. She asked me point blank if it was okay if she blew him, and I told her to go nuts. He asked me the same question when he woke up from anesthesia, and when I gave him the same answer, he gave me a knuckle bump in reply. I love county folk. Used liquid nitrogen to freeze genital warts off of a 20-something-year-old girl. After she touched her genital warts with her hands to show me where they were, I applied cryotherapy and left the room for a moment so she could get dressed. When I got back, she proceeded to grab my hand and shake it after touching all of her warts without washing her hands. Patient here. I was in a small town where my parents used to live, and I had to see a gynecologist. I was worried that I may have had a tampon stuck in my vagine. That's not physically possible, but I didn't know that at the time. Unfortunately, the only doctor I could see was a friend of my parents. After thoroughly probing and peeking, he informed me that there was nothing wrong. In fact, your vagina is, for lack of a better word, gorgeous. I've never been so embarrassed. I had to babysit his kids that weekend. My pediatrician used to substitute this old male doctor sometimes without notifying anyone. It was almost always the days I was coming in for my sports physical. That feel when you're going to get your balls touched by a lady doctor in your early teens, and then seeing an old man snapping latex gloves on. I had one patient who had made her desire for me very public, but since I treated her entire family, I decided not to kick her out and continue to remain professional. In the midst of a bipolomania, she kept complaining of female issues. During her pelvic exam, I happened to look up, and I saw a gigantic smile on her face. After the exam, in the hallway in front of a few residents, she said, "If you weren't my doctor, I'd duck your brains out." Perhaps I should have mentioned this earlier, but she was the only woman I've ever met who is a 0/10. She's the only patient who made me question my heterosexuality. So I heard someone was questioning their sexuality. Somewhat related, but from a patient's perspective. When I was in nursing school, I went to my school's student health center for a gyno appointment. The doctor asked me if it was alright if a medical student was present. I said that was fine. She then specifies the student was male and asks me if that was still okay. I wasn't totally comfortable with that, but as a nursing student I knew how much it sucks when a patient refuses you, so I said yes. Lo and behold, it was an incredibly attractive med student from my school, who I bumped into all the time, and he saw the inside of my vagine. I never could look him in the eye after that. When I was 16, I sometimes got dizzy if I stood up really fast. I'm pretty sure this is relatively normal, but my mom thought something was wrong with me. So she took me to the doctor, and he wanted to check for testicular cancer. I had a worried look on my face, because I didn't want an old Asian man feeling my nuts. The doctor saw my face and thought it might console me if he spoke teenager. He said in his Asian accent, "I'm gonna feel up yo balls." I felt pretty awkward after that. Was it Ken Jeong by chance? My doctor once said, "You're so thin. It's very easy to palpate your organs." Then he felt my spine from the front. It was awkward. If you liked this video, don't forget to smash the like button. For more hits and giggles, subscribe.